Surgery centers provide many benefits to patients, making them more in line with patient-centric care. If you are in the business of hospital management, then you might want to consider building a surgery center. They're easier to manage and do not encounter the same risks that hospital does. Here is how you start. Get information. First and foremost, whether you're building an ambulatory surgery center or a specialized surgery center, you'll need to gather as much information as possible. Identify the type of surgery center you want to open up by looking at the average cost of surgery in your region and evaluate the cost of building a surgery center. The goal here is to provide an incentive for the patient to reach out to your surgery center while at the same time maximizing profits. Select the surgical procedures you want your surgery center to tackle, keeping in mind the cost, number of cases, overhead charges, capital medical equipment needed, and physician costs. Prospect via physicians. Once the surgical procedures are identified, reach out to physicians that specialize in your selected outpatient surgeries and pitch them your idea. The goal here is twofold: to gather information from them if in the early stages of building a surgery center, and to get them interested in being a part of it. Physicians would want to join your business because it means more income for a lower number of surgeries performed. Find a facility. Keep in mind the cost of the facility as it depends on where it's located and its square footage. Make sure that it fulfills your requirements as well as any regulatory requirements imposed by the federal or state healthcare bodies for licensing, certifications, or accreditations. After you have settled on a facility, you will have to renovate it such that it looks like your desired surgical center. Make sure you have essential infrastructures like a comfortable waiting room, information desk, and handicapped accessibility to cater to all kinds of patient needs. Source medical equipment. Consult the physicians in your partnership regarding the medical equipment they require. When starting out, you might want to focus on the essentials like surgical tables, lab equipment, scanning and monitoring equipment, and surgical tools. Devise a patient care plan. Other than physicians, you will require medical care providers that handle all the associated patient care requirements before, during, and after surgical procedures. To keep the process streamlined, productive, and efficient, devise a patient care plan that considers all the checkpoints patients must go through before their surgery is scheduled and after they come out of it. This will be easy to chalk out as your facility will be conducting routine surgeries. Additionally, this process includes managing administrative work like patient scheduling, recording patient data, and gathering insurance information. Hence, you will need to consider employing additional staff that handles these daily needs or consider investing in management software that automates these tasks. Aim for growth. Once you have handled all the necessary legal, administrative, healthcare requirements that greenlight your facility, it is time to open your doors to patients. You can then start handling the financial aspects of your operation that make your business growth-oriented, but make sure to keep patient satisfaction at the heart of your service when building a surgery center. The surplus you generate can be used to employ more physicians and expand your facility to cover more outpatient surgeries, bringing in more revenue. Now that you understand what goes into building and growing a surgical center, it's time to take action. Start your project by connecting with our team and exploring the medical equipment offered through our platform. Click or call 1-866-467-5580 today for more details.